Good afternoon, everyone, and thank you for attending Wayside's Recovery's presentation with Mr. Calvin Williams from Lucian Families. Our topic today is fathers and perinatal mental health, implications for maternal and child outcomes. If you could please, again, we welcome you and we thank you for attending this presentation that is fully funded through the State Opioid Response, which is a SOAR grant from the Substance Abuse and Mental Health Services Administration, SAMHSA, and the Minnesota Department of Human Services. Nothing in these materials constitutes a direct or indirect endorsement by SAMHSA or Minnesota Department of Human Services of content, services, and or policies. Our agenda today is I've welcomed you. I will give a brief introduction to Wayside Recovery Center. We will hear from our speaker, and then we will have about maybe 10 minutes for a Q&A at the end. And then we will share in the chat the next series that we will be having. We hope that you'll be able to attend, and there'll be final closing remarks. I do want to let you know that Mr. Calvin Williams will be presenting again this month, and he will be presenting on Fathers Are Not Born, They Are Made. And that will happen on February 23rd, again in the 12 o'clock to 1 o'clock Central Time Zone. Thank you again. Wayside Recovery Center, if you are unfamiliar, provides gender-specific care because understanding the needs of women are critical to optimizing prevention and treatment. Wayside has been in existence for over 60 years, and we specialize in empowering women and breaking the generational cycles of substance abuse. As a federally certified community behavioral health center, Wayside now provides services to address whole health that are more affordable and more accessible. Wayside Recovery Center is hosting a Project Echo series in partnership with Minnesota Department of Human Services. We would like to introduce our speaker at this time. We have Mr. Calvin Williams, who is a consultant with Lucian Families Incorporated, a Cincinnati, Ohio-based company that provides training, program development, and innovation strategies to community-based and governmental organizations that serve fathers, parents, co-parents, and couples. Mr. Williams serves as the fatherhood coordinator for the Hamilton County, Ohio Department of Job and Family Services. He is a certified lactation counselor and is a co-author of and master trainer for PrEP Inc.'s On My Shoulders fatherhood curriculum. Mr. Williams previously serves as the Director of Fatherhood Services for Public Strategies, Inc. in Oklahoma City, Oklahoma. Before joining Public Strategies, Mr. Williams was a program director for two landmark Cincinnati-based fatherhood programs, the Lighthouse Youth Services, Real Dads Program, and the Services United for Mothers and Adolescents Fatherhood Project. There is so much more that I could share with you about Mr. Calvin Williams, but I know you're eager to hear from him this afternoon. If you would please join me with a warm welcome for Mr. Calvin Williams. Thank you so much.
Thank you, Nicole. And I do hear that warm welcome, even though I can't see everybody. I feel it. Keep it coming. So thank you for allowing me to present to you. This information is important. I've been doing fatherhood work for about 24 years. And I really like that the fatherhood field itself has moved into or has added mental health as a primary focus area for fatherhood programming. And it plays out, it's now playing out in the funding that's available for fatherhood programs as well. So really grateful for that. So I bring you greetings from Cincinnati, Ohio. that would be the home of the Super Bowl bound Cincinnati Bengals. So just got to throw that in there. All right. Well, let's get started. Let me see if I can. Oops. Okay, so let's get started. So first, we're going to look at some of the socio-environmental risk factors for fathers' perinatal mental health. And so, you know, what we're going to talk about here now is, you know, certainly not, you can't ascribe it to all fathers, but or all men, I should say. But there are some pretty strong forces in our society and the environments that boys grow up in that have a impact on how their mental health overall, and certainly how they'll transition into fatherhood. So the first is masculine ideology. Just what are the core tenets of masculinity as it plays out in the research over the years? And what we're going to see is what's widely accepted as a core construct for men moving into masculinity. All right. So one of those is anti-femininity. So in our culture, in our society, boys are taught really early, either overtly or you know, insidiously. They're taught that you want to be everything opposite from a woman or a girl, right? So that's one piece of this construct. The other one is achievement, which in and of itself is a good thing. But I think sometimes in this ideology or in this construct, achievement becomes all encompassing, which is sometimes not healthy. Then there's the avoidance of the appearance of weakness, right? So in this construct, just can't have it. Men just, you know, and boys just really are encouraged not to show any type of weakness at all. Then there's adventure, which is a part of this construct as well. So in the masculine ideology, there is a spirit of adventure, you know, where men want to strike out and dream big and do big things, experience things. Then there's also risk, right? And that it comes right after adventure, because sometimes that adventurous part of this construct involves quite a bit of risk to men's mental and physical health. Find my pointer here. And lastly, there is violence, right? So boys are socialized early that aggression and violence are reasonable, acceptable ways to respond to the difficulties and struggles that life will bring, right? So this is a construct that is still holds a lot of validity, even though we hear about and talk about men moving into more you know, egalitarian spaces or being more interested in healthy relationships, that type of thing. But this construct still holds sway. And I want us to keep this in mind as we move through the rest of the presentation. Okay. So next, we're going to look at a brief video that really crystallizes what we're seeing now and shows in a graphic way how this process can work against men's health and well-being. Oops, sorry. So as you can see, this is really a graphic description of what we just talked about, that construct of masculinity. And, you know, starting from infants and toddlers, and really right around 4 or 5 years old, you know, we begin the process of asking boys to, you know, hide their emotions or shaming them about that, or that's not what big boys do, and that type of thing. And so you see that narrows the range of their emotional expression, which obviously increases internal emotional stress and pressure, which culminate in the things at the very top of the picture. Okay, so let's go to what the literature has to say about challenges for fathers in the prenatal period. Three main areas of difficulty in this period. One is the feeling of unreality, right? So despite the fact that, it's a relatively new tendency for men to be involved in the prenatal process, they frequently experience ambivalent feelings during the early stages of their partner's pregnancy, right? So my child is a concept, more of a concept than an actual person in the early stages of pregnancy. Second area is the couple relationship. So what can happen is a real or perceived disequilibrium can result in the relationship, which involves a divergence between male and female expectations inside the couple relationship early in the pregnancy. And the third thing is the formation of a parental or paternal identity. So for men, this is a core identity shift from the role of partner to that of parent. And then in the labor and birth period, we have men can feel helpless, anxious, useless, not expecting the demands of labor, vulnerable, feeling out of place, unprepared for what's happening, and in need of psychological support. And in the postnatal period, this is there can be a frustration at the lack of involvement in the homecoming process. And I know, just think about that, how often and how well are fathers engaged by maternal child health staff, hospital staff, about the homecoming process. And I think most of us know that there's so much attention placed on mom, righteous attention placed on mom, but we absolutely need to think about what dad's thinking and feeling in this time. There's a need for him to learn more about his infant's characteristics, looking for time to establish an intimate contact with the baby. And sometimes that clashes with the increased idea, if not pressure, that I need to provide for my family, right? And so think about this, for any man, but certainly for low-income fathers or fathers who are poor and have to work the way they have to work to keep food on the table and a roof over the family's head. So that can impede with time to establish that intimate contact. There's a restricted sense of freedom that can develop, along with a perception of not being as skilled in infant care. And finally, a sense of deterioration of the lifestyle, sexual relationship with the partner. So after childbirth, fathers, they can feel torn between the way their lives used to be and what they view as a new phase in their existence. And without, the research and data to help, tear down myths or misguided ideas about men, there are too many people that would still consider men as just being selfish, right? I've actually, that's been lobbed at me at different points in my life, when in reality, I really need some support, right? And a way to bring myself closer to the family and the newborn infant. So three main factors that affect fathers' mental health in the perinatal period. Again, the formation of the fatherhood identity, competing challenges of the new fatherhood role, and negative feelings and fears related to it. These are the three main challenges observed in the literature. And as a practitioner for these past couple decades, these are things that I see when I'm working with fathers, whether they are first-time fathers or not. What these can result into is anxiety and depression becoming really common in the perinatal period. The tune of anxiety disorders have been tracked at 4.1 to 16% in men prenatally. And then about 2.4% to 18% in the postnatal period. Then you have depression, which has been tracked at about 10%, a little over 10% between the first trimester and 1 year postpartum. So in the literature, it's clear that fathers wanted more guidance and support around the preparation for fatherhood and the partner relationship. And that's I think we can all agree that some of that is really missing, maybe a lot of it, to be honest with you, right? How are we preparing fathers for fatherhood, and how are we preparing couples for the changes and challenges that will come in their relationship based on the birth of the child, and the changes and challenges in each other as individuals as they transition into their new parenting role. So some of the barriers for fathers getting help is lack of tailored information and resources. So very few fathers are going to be presented with tailored information, not just things that they give to parents and families, but tailored information and resources. And then there's the other thing is a lack of acknowledgement from health professionals. I don't know how many fathers I talk to, and now I'm keen. I've been a CLC now for the past 5 years, and so I'm really keen to asking fathers in the prenatal period or at the labor and delivery phase, how are the health care providers interacting with you? And most of the information I get, now this is qualitative and anecdotal, but most of the information I get is not well. Okay, so there's some things to be done to shore that up. All right, so with regard to depression, there is a symptomology of depression listed in the DSM that includes frustration, agitation, and irritability, an increase in dopamine boosting activities such as drinking or drugs, gambling, and then there's isolation. So typical symptoms of a major depressive episode may include feeling sad, crying, recurrent thoughts of death, losing interest in activities. But for men, it may show up differently. It may have some of those things or may not, but oftentimes there's these other signs, right? And how do people read men's frustration, agitation, and irritability, right? They read it as anger, or they read it as, they don't associate that with what may be going on inside the man. So it's that question that we've learned to ask now, instead of what's wrong with you, what happened to you? Or what's happening to you in this phase? What's happening to you right now? So looking at some of the implications for maternal and child health, we'll see that when mother's ability to parent is impaired, fathers tend to function as a buffer between negative maternal behaviors and potential negative impacts on child outcomes. So this is what's possible, right, for fathers. But if we think about all the things we just talked about prior to this point, what can get in the way? What can be factors that shift that father away from his role as a buffer or create an inability for him to do so? So, on the other hand, paternal mental health problems can dampen a father's ability to engage effectively with his child. So that's a big factor for MCH providers to think about. The other thing is paternal depression is associated with increased negative parenting. So psychological control, hostility, intrusiveness, and decreased positive parenting behaviors such as affection, positive involvement, and supportedness. So it also is associated with maladaptive parenting behaviors toward children and negative child outcomes. So the father's mental health in this perinatal period is connected to not only his own functioning and well-being, but to his child's functioning, growth, development, and well-being as well. And then there's bipolar, right? So bipolar disorders in fathers have an impact on the stability of interparental relationships, and ultimately the child's emotional health. And some of the data in the research looks at the third trimester, the first 1 or 2 months postpartum, and then 12 months postpartum. And we're seeing prevalence of manic depression or hypomanic depressive symptoms as well. Now, there's limited research, but it does suggest that fathers have an increased incidence of hypomanic episodes after having a child. But there's insufficient data to ascertain the unique effects on father parenting behaviors and child mental health. You know, it's really difficult to run large scale research projects involving fathers, because men are not really used to engaging with research or participating in research, especially when it comes around something that a lot of men, kind of believe that they just are inherently supposed to know what to do and how to do it. Now that's a quiet kind of fact, right? That fathers, they don't want to be talked to about fatherhood because they have this idea that they're supposed to know the role. And in reality, they need as much support and information as mom does in order to make this transition into fatherhood. But until we start getting more large scale studies on fathers, we'll keep just figuring out what are the things that impact their mental health in the perinatal period. We did a small study in Cincinnati here with the Hamilton County, Ohio Department of Job and Family Services in partnership with University of Cincinnati and their Center for Clinical Translation Science and Training. And in that study, it was really small, and it's not, we couldn't generalize those results just the way we ran the study, but we did come up with, we talked about fathers and their health. That was what the study aim was, to see what fathers are self-reporting about their physical and mental health. And in terms of the question, how often do you feel depressed? In the pre-survey, which N equals 21, there were 11 fathers who indicated that they never feel depressed. And there were 10 fathers who indicated that either daily, weekly, or monthly, they do feel depressed. And in the post-survey, where the N was 18, we had 5 fathers instead of different from the pre, which was 11. We had 5 fathers in the post-survey that indicated never feeling symptoms of depression, and 13 fathers indicating that they have at some time or in one of those frequencies, daily, weekly, monthly, or a few times a year. Okay. Now, looking at anxiety, maternal anxiety symptoms are associated with over-involvement and impaired parenting behaviors as early as infancy. So this is something that, when you see fathers just hyper involved with the child and hyper concerned, and, that may be a sign that they're somewhere on that anxiety scale or continuum, being that they're a first-time father. And then there is a longitudinal relation between maternal anxious symptoms and an increased risk for children to develop psychopathology that is evident throughout a child's life. And so when we think about implications for maternal child health, these are some very real potential outcomes when fathers aren't supported with their mental health, supported with the transition to fatherhood, and supported in the transition of the couple relationship, that dyad, becoming a triad. So this lets us know that, there's work to do. And I'm often fond of thinking of fathers when it comes to maternal and child health as the secret weapon, but they need to be supported and guided into spaces, within themselves, and then the environment that they're in needs to be set up to let them know how valuable and important they are. And as we said earlier, have specific tailored resources for them, not just things for the family, right? And also, we also talked about the attitude of healthcare providers. And so that's a self-check for people working in maternal child health. Where am I with, considering fathers and their mental or emotional needs during the pregnancy, at labor and delivery, or postpartum? So that's a serious question that we have to ask ourselves. Okay, so we are now going to hear from a father who happens to be a pediatrician on his experience with perinatal depression.
After suffering from postpartum depression himself, after the birth of his two children, he became a speaker and advocate for fathers' mental health.
Well, some of you do and some of you don't know about the way that postpartum or perinatal mental health can affect new fathers. And frankly, up until the birth of my child 7.5 years ago, I didn't either. When my wife became pregnant, we were both very excited that we were going to have a boy, and the pregnancy went very smoothly. And during the entire 9 months, I didn't experience any worries at all. My wife had worries. I did not have worries. The baby was born. Everything went pretty smoothly. But even in the newborn nursery, looking back, I started to feel a little concerned just because I felt that my son cried a lot. And as I've been a pediatrician for 16 years. So this is roughly the halfway point of my career. And I had never taken care of a child. I had only taken care of other people's children. So the baby felt like he was crying a lot. My son's pediatrician told me nothing to be concerned about. And I kind of put it on the back burner. We went home and my wife had a little bit of the postpartum blues, which, as everybody knows, are very common. She was having a hard time breastfeeding. We had the bris, which is the circumcision, and she started to feel better. And by week 2, I started to feel worse. I had taken 2 weeks off to be home with my wife and the baby. I wanted to help out. I wanted to be an equal parent. And during that time, I began to feel worse. I would become increasingly frustrated and angry at my son. Not angry at my wife, but just angry at my son. I started to feel that there was something wrong with my son. And even if the pediatrician didn't think so and my wife didn't think so, I felt so. And it was during this time that I also started to have some very negative visions and images in my head when I was at my most stressed. It wasn't until years later that I realized what this was, but at the time I definitely remembered feeling it. So I went back to work for weeks 4, 5, and 6, and I just got progressively worse. Every morning I would wake up and I would curse him. Every day I would come home and he would be calm, and my wife would give him to me and he would start crying, and I would say, "Get him away from me, I don't want him." So for the next 2 weeks, we had a baby nurse Monday through Friday, and I went to my first 2 sessions of therapy that I had ever been to. And I was taught about cognitive behavioral therapy, and the therapist, who had never worked with a father before, which is a common refrain with me, where I would work with people who definitely worked with moms but never worked with dads. Luckily, between the therapy and the fact that my son turned out to be what's called a 4th trimester baby, which meant he spent the first 3 months being basically miserable, at least to me. And then by month 4, suddenly by week number 12, it was as if a light bulb had gone off in him, and suddenly he wasn't crying all the time. He didn't seem irritable, and he was crying when he was hungry or when he was tired or when he pooped, and that was it. Starting to acknowledge what was going on with me, my son started to get better too. And that month that I spent with him turned out to be a really great month. I gained confidence in being a parent.
Okay, so that really was striking, right? You have a veteran pediatrician who himself is experiencing the postpartum paternal depression. And as he stated, we made the point earlier about, healthcare providers, maternal child healthcare providers, not really focusing on fathers. And Dr. Levine made the point that he's even going to a therapist who'd never worked with a father. So not only maternal child health, but, the mental health field and just the health field in general definitely could pay more attention to fathers, and most importantly in this perinatal period, given some of these outcomes, that potential negative outcomes for mom and the baby. Okay, so now let's look at some implications for practice. You know, what can all this mean for how we go about our work in the maternal child health field? And importantly, we want to start looking at parental mental health in its interrelatedness, right? So not only to fathers and mothers, but to fathers and mothers towards their children, the outcomes, the potential negative outcomes for their children. So when we're talking about pregnancy-related worries or emotional intelligence, birth experience, depression, resilience, anxiety, PTSD, some of which we already talked about, we need to think about that as being interrelated into that couple relationship, right? Because if you go down a little further to the middle of the page, what we're used, the traditional approach is mom and baby, right? So with that focus on mom and baby, we aren't paying attention to that couple relationship dynamic, which is satisfaction, dyadic coping, and even intimate partner violence, right? And so we want to expand the idea of parental mental health into a family context, right? So that we can, you know, design treatment approaches and measurement tools that meet that goal of looking at parental mental health in a family context instead of mom and baby, okay? So those implications for children and their parent relationship are pretty stark, right? Parental sensitivity is at stake, parental child bonding and attachment is at stake, child temperament, and even child sleep is at stake when we aren't treating the entire family or looking at the entire family in a parental mental health context, right? So, and again, we talked about there's just not a whole lot of research. I mean, it continues to emerge, but there's still a dearth of research around paternal mental health in the perinatal period. But what we can do is think about protective factors and positive outcomes when we think about the family, and then, you know, putting that focus on the father to balance that out. Dyadic and triadic designs in the research going forward, alternative family constellations, LGBTQ plus families and the role of extended families. And then we need more culturally diverse studies to include low and middle income families in different countries too around the world. So these are the things, this is kind of like a framework for how we want to think about both research and practice going forward, right? If we can just think about this transition from the traditional approach into a more family context. So one of the things that's happening in Ohio towards these challenges and opportunities, we are doing a statewide paternal depression study, right? So it's the Father's Feeling Study run by Ohio Guidestone out of Cuyahoga County, or the Cleveland part of the area of the state. And so this study is going on its second year. It's a 3-year study. And we are really trying to, and I say we because I'm involved in the study with Ohio Guidestone as a fatherhood practitioner, providing guidance and referrals to the study. But our idea is to validate a tool that will accurately measure, you know, depressive and other symptoms in fathers of first-time fathers or fathers of newborn babies, right? So that's one of the ways that we're reacting to it. And I'm really proud of this. Ohio Guidestone and Brittany Pope, who's the lead investigator on that study, really poured a lot into this, and it really holds promise for not only maternal child health providers, but for fatherhood practitioners, right? I mentioned earlier that, you know, the fatherhood field from a practitioner standpoint and programming and service standpoint has moved into mental health, but there's more movement to make. There's more work to do to incorporate that. And so in Ohio, this is one way that we are looking at doing that. And what I really like about this study is that they are fathers are participating in research, but they are being served and helped at the same time, right? So you see there are 5 total sessions. 2 of them are clinical consultations where there is a depression screening. There is a clinical consultation and referrals as needed. And then there's what they are called brief interventions, the 3 sessions there, with reflections and feelings on fatherhood, nurturing skills based on a baby's stage, specific resource presentation and referral, the importance of play and father-specific strengths, the Joyful Together curriculum, and then men's wellness. You know, the importance of play takes me back to the For Fathers Only little small study we did here with University of Cincinnati. In both the pre and post surveys, in the question that asked fathers to rank their choices for most important duties or roles of a father to least important, the one item that spoke to encouraging creativity in your children was ranked the lowest by both the pre and post group. So that really stood out to me, because we understand the importance of play in children's neurological development, the importance of play in their development of emotional regulation, the importance of play and creativity in preparing them to learn. And so when those numbers came back with fathers ranking investing in or supporting my child's creativity, when they came in that low, that was a flag for me to let me know we need to get this message out to fathers about play. And that's why it was included as one of the interventions in this study. So ultimately, we want to raise awareness and screening for depression and dysregulation in fathers during pregnancy and the first year of baby's life, increase or enhance self-efficacy and fatherhood appreciation, and utilize play to increase or enhance nurturing and caretaking skills. So really well designed, and really glad to be a part of the Father's Feelings study. Okay, so that's what I have. I will encourage you to go to the lucianfamilies.com/media page, and you'll see videos there about fathers and breastfeeding, fatherhood, as well as different ways that fathers are being engaged by community-based organizations to get their needs met. So with that, I will turn it over to Nicole to take us into the Q&A.
Yes, wonderful, wonderful. My goodness, I so appreciate this presentation today, and I know so many others. I'm going to turn it over to Zora for Q&A. If you can please place your questions. I know we already have one from Mother Hazel Tanner there, Zora, but everyone please place your questions in the chat, and Zora will moderate from there. Thank you.
Thank you. Great presentation. Important information. So again, like Nicole said, if you guys could just place your questions into the chat, and I can read them off here. We do have one from Hazel, and that is, what is dyadic and triassic designs?
Okay. Yeah, she almost went into what's that? The ancient world with the Triassic.
Yeah, that's what I thought of at first.
Right. No, so dyadic simply means the two, right? Triadic means the 3.
Okay. Thank you. And that's in regards to like family systems, I'm guessing.
Correct.
Yeah.
Correct. So in our culture, in social service, human service, and again, even in maternal child health and other services for pregnant parents, the dyadic takes command, right? The whole focus is mother-child, right? And certainly you need a focus on mother-child, especially with how this country and our society's negative impacts on pregnancy and birth. So you need that focus, but it shouldn't be a all-consuming focus, right? Men are being left out of critical decisions. They're being left out of supports and services, and it doesn't bode well for mom and baby for that to happen. So that's why I'm stressing that, shifting from that dyadic view of mom and baby to the triadic view or family-centered view, right? Where mom, baby, and dad.
Great answer, thank you. So what resources, I know you talked about the virtual study, but are there other resources out there specifically for fathers?
With regards to mental health?
Parenting, mental health, yeah.
Yeah, there are a lot. I think there could be more, but watching the fatherhood field develop over these past couple decades, I see the proliferation of fatherhood programs in communities around the country. I mean, Ohio itself, there are 5 or 6 cities in Ohio that have fatherhood programs that are over 15 years old, right? And so the federal government has done a good job. The Office of Family Assistance, the Administration for Children and Families, of funding fatherhood programming. And now their funding has even moved into relationships, right? So that wasn't a big focus in the early years of the federal funding for fatherhood, but it is now. So it should be easier to find a provider in your local area or somewhere near you that specifically serves fathers.
Okay, great. And again, you guys, if you have any questions, please put them in the chat. See if there's any.
I have a question, Zora, while we're waiting
Okay.
for others. So, Kelvin, in listening to this and being a mother of 3 children, and so I've got college age and then an adult. When I think about the birthing classes I went to and how there was nothing for dads, I'm just wondering, where it's been a while since I've had children, have birthing classes changed? Is there curriculum where it works to support families, kinship groups in a different way? Is there anything out there that maybe we should be making families aware to support this narrative and valuable information that you're providing us with?
Yeah, I think there's a lot of work to do in terms of having resources available more widely. And again, it's important, community-based fatherhood programming, yes, but we need to bring these ideas and develop resources inside the maternal child health space, right? So fatherhood programs are well and good, but it's really clear to me that in the prenatal phase, in the clinics, whether it's WIC or other programs, and listen, that's happening, right? As a matter of fact, Reaching Our Brothers Everywhere out of Atlanta, Georgia, which I'm one of the charter members of, that we are creating content and programming. We're actually bringing awareness to this idea of the need for fathers to be engaged in maternal child health. So it's coming, but there's a lot more work to do. I know the Dayton Children's Hospital, I'm in Cincinnati, Dayton's about 50 minutes north. They asked me to come present on father's role in breastfeeding success to a group of resident physicians, right? Which was amazing, because one of the biggest things that we know is that in medical school, there's not a lot of attention on breastfeeding. There's not a lot of attention on fathers, and there's certainly not a lot of attention on the ability of fathers to have a positive impact on breastfeeding outcomes. So really, that's a long no. We got a lot of work to do. We really do. So, but when I'm standing in front of those residents, it was a golden opportunity, man, for me to try to plant seeds in these physicians. They're going to go spread far and wide, and just to help them think about fathers more differently. And here's the benefit of having this conversation, right? So locally, that For Fathers Only research project I did involved 3 physicians from UC Health, University of Cincinnati Hospital Health Center. And all of them were Black men, so we needed that for our audience to be culturally competent. 2 of them were psychiatrists, and 1 was a general practitioner. But after that session, the next day, a father texted me, literally a 200-something word text. He was quiet, in the session, but that next day he unloaded his need for mental health support. You know, he literally was begging me, help me save myself and my family, right? And can you imagine how long he's been walking around with that, you know, until somebody shows up with some relevant, culturally competent, tailored information just for dads, right? That's what we need in the maternal child health space.
Definitely. And it looks like we have like 3 questions that came in, so I'll just read them off. The first one is, do we have any online resources for self-psychoeducation specific to understanding family-centered approach?
Online resources, I'm not aware of that. I know that the National Fatherhood Initiative has an online fatherhood curriculum or class, or that programs and agencies can use, but I don't know how much it delves into mental health, right? We're just going to have to build this out. You know, those of us who care about moms and babies and families, we're just going to have to build this out, man. And it's conversations like this that happen. I lost my point, Berkeley. I wanted to tell you that after those sessions with those 3 physicians, maybe about 3 months later, one of them, the psychiatrist who owns a private behavioral health and counseling agency, he reached out to me and said, by being involved in this project with you, I came to see that in my own practice, we're not doing enough to engage fathers. So that's how important these conversations can be. Yeah. So we have the head of a behavioral health agency that saw the light, right? And asked me to help him think about how can we do better, right? That's the importance of having these conversations.
Yeah, they're definitely planting seeds.
Yep.
We have another question. Are there plans to expand your work around fatherhood engagement beyond the prenatal period to other stages of development? So for example, early childhood, adolescence, et cetera.
Absolutely. Absolutely. And that's what the fatherhood field has been about. And, you know, my company, yes, we have that focus on what we call the stages of development for a father. So absolutely. And early childhood is a big focus. I work with early childhood providers and also work with early childhood associations and networks to bring that fatherhood perspective in. So there is attention to the lifespan of fathers, right? From, preconception all the way to having school-age children, graduating from high school. But there's, again, I hate to keep saying this, but there's still more needed. But I am positive about what I'm seeing in what's being presented and made available to fathers about early childhood. And, that's a big focus of, some of the work I do. It's almost a mission for me to get neurological development data and research, drilled down, translated, and organized for consumption by men and fathers to understand how important their role is in preparing their child for early learning. So, yeah, we've got good work going on in that area.
I think we just have one more question that I'm seeing in the chat here. Again, if you guys have any other questions, please put them in the chat. So we have one that says, our organization primarily focuses on the health and wellness of Black women, but would love to create opportunities for Black fathers to receive support in the maternal paternal health space. What advice would you give for reaching Black men and fathers? What's the best way, in your opinion, to get their attention?
From the perspective of a Black women's health organization?
Yep.
Okay. Well, Reaching Our Sisters Everywhere has really kind of set that model up. I don't know if you're all familiar with Kimmery Bug in Atlanta, Georgia, and Reaching Our Sisters Everywhere, which has been for the last 10 years really being a champion for Black maternal health outcomes, particularly breastfeeding. So 5 years ago, they launched, Reaching Our Sisters Everywhere launched Reaching Our Brothers Everywhere. So that's an example of an organization that was dedicated and focused on women, that saw the need and actually acted on the idea of creating something incompatible with what they're doing but for men. And so, you know, I'm fond of saying it's hard for people to just, you know, hang a shingle on what they're already doing and say, oh yeah, we're doing father, right? And I've seen that happen over the years and watched those efforts be ineffective or fail. So there has to be a wholesale commitment in your organization, in your practice, in your agency, in your community-based group. There has to be a wholesale commitment to focus on, provide services for, and support dads, because dads really can feel when they're in a space where somebody's offering them services, they can feel whether it's genuine, relevant, or it's going to be helpful or not, right? And so we want to, if you're in a women's organization, yeah, you want to get some training on ways to engage fathers effectively. You know, you want to take in information or get training on, you know, fathers' needs, right? Because a lot of times organizations that start to serve fathers aren't zeroing in on their core needs. And for low-income fathers, especially, man, just the pressures and the stresses on them, being targeted in their communities, and you know, lack of employment opportunities, and trying to shake off the trappings of the mass incarceration scheme. You know, those are the fathers that I work with mostly, and I really do advocate for them, because we're still seeing them as a problem, right? And what I want to do is help people move from thinking about these fathers as a problem to men who have problems. So if I'm a women-led organization, that right there, that paradigm shift right there can take you a long way.
Sure, thank you. And it looks like Nicole wrote down those two organizations that you had mentioned, the Reaching Sisters Everywhere and Reaching Our Brothers Everywhere as well. So thanks, Nicole. It looks like we do have another question. And this may be the last one, Nicole, or well, I haven't, yep, this may be the last one. So new parenting includes both socioeconomic and effective emotional aspects that promote sustainable behavioral changes, and a philosophy of couples that is different from the traditional one. And it's a question.
All right, you got to help me out with that a little bit.
Carlos, I don't know, are you able to unmute? Do we have the capabilities for that? Do you want to elaborate on that question?
You can go ahead and state it again, please.
Okay. New parenting includes both socioeconomic and effective emotional aspects that promote sustainable behavioral changes, and a philosophy of couples that is different from the traditional one. So I think maybe the question is that right?
Yeah.
And Carlos just added, I mean, a personal revolution.
Okay.
And I understand that too, in the way of, right, cultural experience, lived experience, right? When you think of us in the diaspora, right, our socioeconomic and emotional is very different depending on our income, right? And our resources. So that's how I'm kind of interpreting that, Carlos. I don't know if that helps.
What it makes me think of is that we tend to think that, you know, the cultural aspects of fathering are the most important, right? And there's really good research, particularly by David and Diane Schwab. They wrote a book a few years ago looking at fatherhood in the United States and about 11 other countries around the world. And one of the things that was consistent throughout that book was that culture impacts fathers implicitly, right? So the cultural aspect of fathers is implicit, but the socioeconomic and environmental factors affect fathers explicitly, right? So culture alone can't do it, right? The space that fathers are being raised in, the fathers are operating in. I'm fond of saying, look, if you want to be effective in your area, whether it's your agency, your city, your town, your state, engaging, serving, and supporting fathers, you have to make sure that whatever it is, your agency, your community, et cetera, looks like, sounds like, smells like, talks like, it really values fathers, right? So yeah, so the cultural implications, yes, they're important, but they don't trump, things like lack of affordable housing, racism, lack of job opportunities, the fact that, fathers in communities, they don't set trade policies, but trade policies affect them materially down the line, right? So all these external things, the environment and the socio-political and all these other things, they affect fathers explicitly more than culture does. So culture can't override all of that.
And Carlos
I
said
hope that's
exactly.
helpful, Carlos.
Yep. Carlos wrote in exactly, totally agree.
Okay.
This has been one of the most, I appreciate all my speakers because I may have some potential speakers who are tuning in. I appreciate all my speakers, but I just am so grateful that Mr. Calvin Williams said yes to us, not just once, but twice, to really allow us to process this most valuable information as we are trying to impact the lives and the well-being of maternal and infant health, right? And families in our community. And I know that we'll all take this information back to our community. So once again, I would like to just thank Mr. Calvin Williams and everyone really who took time out of your day to be here. But I'd love to challenge everyone as well. Let's not miss the 23rd. Bring a friend, bring a colleague. Please share the links with others so that we are engaging together in this space. And please let us know how we can support you. Thank you, everyone. Have a great afternoon. And Zora's placed in the chat. Our next session happening tomorrow, if you're available, is with Dr. Sarisi West Olatunji. She is out of, I believe she's in Philadelphia, and she will be speaking on transgenerational trauma as it relates to maternal and infant health. Please join us and have a great, great day.
Thank you, Nicole and Zora. Thank you, everybody who attended.
Yes, thank you, Calvin.